In other news now, healthcare workers need to brace themselves for a bumpy season of respiratory diseases. For the past 2 years, the country's been battling a COVID-19 outbreak and has recorded low levels of traditional influenza and other respiratory diseases. But recently, there's been an increase in respiratory diseases amongst children, and some experts are predicting this might become severe. For more on this, I'm now joined by Professor Adrian Puren of the National Institute of Communicable Diseases. Prof, thanks for joining us this evening. Always good to have you on. So one of the few positives from this COVID pandemic, and there have been only a few, was the fact that we had almost no cases of traditional influenza and even the common colds, because we were washing hands, we were sanitizing, we were wearing masks, and we weren't moving around too much. But of course, that time has probably now come to an end, and we're not looking after our personal hygiene as effectively as we were during the time when COVID was at its worst. Is this the reason why we've seen this spike in RSV, or respiratory syncytial virus?
Yes, I think that's part of the explanation. I think that it may be a bit more complex than that. In essence, because we had with the pandemic, we had the COVID-19 virus in place, which has a high degree of transmissibility, and Omicron is a good example of that, which essentially displaced all the other viruses in terms of transmissibility. But you're quite right. I think the other contributing factors are the fact that, in fact, because they're less transmissible, it's better to control under those conditions of having mask wearing, although that did not affect SARS-CoV-2 transmission to as great an extent. But certainly those particular functions and particular hand hygiene and so forth certainly play a critical role in controlling particular influenza. But we certainly are seeing a resurgence of at least the RSV, or respiratory syncytial virus, in children. And again, a collaboration with the NICD has certainly indicated that, in fact, we may see a larger increase. And again, this is not to say that this will happen. This is really modeled data, again, to show that because of the immunity gap, we may certainly see a marked increase in children having RSV. So again, it's really critical that our hospitals not only be ready for a resurgence, a fifth resurgence, but also, in fact, that there may be a resurgence of RSV in children and infants in particular.
Talk to me about
this, what we call an immunity gap.
Indeed. Now talk to me about the numbers that you guys are keeping an eye on and are able to model to see where this RSV season is going to take you. Because according to your statement, you've detected, RSVP has been detected in 19% of children aged under 5. And then you look at specific weeks from, I think, the middle or the beginning of February, and looking at specific numbers and how they are increasing. What are you seeing in those numbers, and where does this model then take us to as we head towards winter?
Yeah, so the NICD has been very fortunate, the country has been really fortunate in that we have what we call sentinel surveillance. And again, we certainly look week by week what's happening in the different settings, whether that be so-called mild diseases, which we call the ILI surveillance, or the more severe disease, which is looking at pneumonia specifically. And so looking at specific sites around the country, we're able to monitor what's happening in the different age groups, and in particular in children with regard to RSV and as well as influenza. So we keep track of what's actually happening in terms of a so-called positivity rate, as we've been reporting for COVID-19. And again, there's a particular structural model that tells you whether or not you're in an early phase, or that you've broken the threshold and you're now a moderate to high phase of a trajectory in terms of infections. And that's how we keep track of these particular infections. In fact, it then becomes, if you like, generalizable to the whole of the country. That applies not only to RSV, but to influenza. And of course, as you've seen with COVID-19, we've been keeping a similar track as well in these particular sentinel sites.
Okay, so how does RSV present? There'll be parents watching now and say, is it just the constant sneezing I should look out for? Does it present as bronchitis, or is it cold first? What should they be looking out for? And what are the environmental factors that we should all be taking into consideration, and where kids who find themselves in those environmental factors are even more at risk?
Yeah, so again, RSV is fairly widespread because, again, it can present with very mild symptoms. But I think what is really critical is when you start having severe disease or symptoms, especially in young children, influenza, bronchiolitis, in fact. In other words, there's marked distress in terms of breathing and wheezing, change in color, becoming what we call cyanotic or blue. So those are the children that really need attention, and those are the children that probably end up in our ICUs and need oxygenation, for example. So again, it's really parents really being really sensitive to what's happening to their children, in particular their breathing and so forth. So that's really key. So again, we come back to how do we prevent some of this. And again, it's those very basic things that we've been talking about with regard to COVID-19, again, especially in younger children where we have opportunities to prevent transmission, and that's cough and sneeze hygiene. That's really critical, as well as hand hygiene to try and prevent transmission of these particular viruses. And that applies not only to COVID-19, but also to RSV and to influenza as well.
Now, I see in your statement you have listed what you believe are the best preventions of it, but how would you suggest is the best way to treat it as well? Because not everybody who finds himself, or every child that finds itself being diagnosed as having RSV will end up getting so seriously ill that they need to end up in hospital. So that is a good thing. But I do see you advise that prophylactic antibiotics for children with upper respiratory tract infections is not recommended. Can you explain that to us?
Yes, again, so these are viral infections. So unless you get a super infection, in other words, you get a bacterial infection, antibiotics is really not recommended. And the fact that goes across the whole spectrum, that in fact, when you have viral infections, it's best not to treat with antibiotics, in fact, because that just really worsens our antimicrobial resistance problem that we are currently having. So it's really focusing, looking at the extent of the infection. So if they're mild, then just symptomatic treatment. But if it is severe, especially in the younger infants that need hospitalization, then take care of that rather than putting them on to antibiotic treatments. There is no current vaccine available for RSV, but there certainly is for influenza. So again, my recommendation, not only in children, but in fact in adults where there is, again, a high risk of influenza, especially in the older age groups, individuals who have comorbidities such as cardiac and respiratory diseases, they should really become vaccinated as well. And in fact, the recommendation is that you don't have to wait for your COVID vaccine and then the influenza vaccine. You can have them simultaneously now is the recommendations. Again, I really would urge people to become vaccinated.
Gosh, with all this talk of the COVID-19 jab, one almost forgets that it's almost time for the flu season jab as well. Just very quickly before I let you go, is it too soon to say whether or not you're expecting a rather worse flu season this year for adults specifically?
It's very difficult to predict. Again, we've had this immunity gap. I know we've made selections around which vaccine to use, and sometimes those selections don't always work out well, so it's difficult to predict what will happen in this particular season. We just hope that there's not a worse season, but I've already said that at least with the RSV season, we do at least have our model to indicate that because of this immunity gap, that we may see a worse season in RSV compared to, but I'm not saying that the influenza season will necessarily be worse. It's always very difficult to predict. It's a difficult virus to work with, but given our experience with COVID-19, that may not always be the same case.
But I'm sure you and your team will keep us abreast of all of the information that you're processing. And thank you so much for the work that you do. That's Professor Adrian Puren of the National Institute of Communicable Diseases.